And as of today, AAA says Illinois' average price for a gallon of gas is $4.56. Although the price of oil has gone down a bit, we'll see if that translates to gas prices soon. And prices are high all around. Inflation rose nearly 8% last month compared to February 2021. It's at the highest level since 1982. The cost of food and energy is also rising the most. And as we've just heard, while the increase in the cost at the pump or in the checkout line impacts everyone, those who are already operating on a tight budget may be feeling the impact most acutely. And joining us now to discuss how the rise in prices is impacting the communities they serve are Peter Beal Del Vecchio, CEO of Marillac St. Vincent Family Services, and Roxanne Nava, Executive Director of Metropolitan Family Services in North Center, located in the Belmont-Cragen community area. Well, thank you both for being here. Pete, how have you seen inflation and rising gas prices impact the families that you serve?
Harris, thanks for having us on. It's been completely evident. Just last month, we served over 400 families in our East Garfield Park pantry. So well over 1,000 family members. And that's up 16% from a year ago. And we had to actually order 6 tons more food to meet the demand. So it's very real in terms of the impact.
Wow, so up 16% from the height of COVID a year ago. Roxanne, are you seeing the same thing in Belmont-Cragen?
Paris, thank you also for having us. So Belmont-Cragen many would argue was one of the hardest hit neighborhoods in the state of Illinois and in Chicago as it relates to positive cases for COVID. So on top of the COVID pandemic, we have an economic pandemic as well. And so we have seen another spike of demand for services of Metropolitan Family Services as it relates to behavioral health, domestic violence. And as an example, as we're serving a family in behavioral health, it's hard to think of that when you're thinking of how am I going to get to work? How am I going to feed my child when everything is so exponentially more expensive? So we have seen a spike in services.
And Pete, give me an example of kind of the kinds of decisions that families have had to make to deal with the spike in prices.
Sure. We've got a lot of reports of families sharing what resources they have within their families, but also to neighbors who are unrelated. And that's a major impact for them. We have one gentleman who's got an elderly father who's trying to keep his heat as low as possible to keep his electric bill down. Because right now they're both making the choice not to have a cell phone because they can't afford to have a cell phone and put food on the table and pay their bills. And so very real choices. So we're happy to be able to step in and provide food and toiletries and other things that have been, we've seen a lot of requests for.
And Roxanne, I want to get back to what you just said about the spike in services as it relates to mental health, domestic issues. Is there a connection here between those things and economic pressures like inflationary costs?
There is. So to give you an example, we have, an example of a home visiting program where the mom passed away due to COVID. And now the grandmother is the guardian of 3 young children. And so it's not very easy for this grandmother to go re-enter the workforce while trying to really stabilize the children. And so these are real things. The thing is that we have a very resilient community. So while we provided direct services, organizations such as Pete, when we know our clients need food, we partner with, organizations for food. We partner with organizations for housing. We partner with our city, state government officials. We partner with our medical partners so that they are on site providing vaccines, on site providing the healthcare resources that our community needs. So we see the spike in domestic violence. We meet the client where they're at. So they might come in for domestic violence, and then we address through wraparound services the other needs that are in that household, such as early childhood services, making sure there's a safety plan. So, but the spike is challenging. We're very fortunate to have our best asset, which is an amazing staff, amazing team.
And clearly, I mean, compounding problems over the last 2 years, starting with COVID. Pete Beal Del Vecchio, both of your organizations here have had to be very active over the last couple of years. Does your organization have the resources to meet the needs right now?
Yeah, you know, we've been lucky. The Food Depository has been a fantastic partner. Again, places like Metropolitan. I just want to echo first what Roxanne said about just the mental health impact and needing to be trauma informed and how great the staff is to respond there, because this is long-term, you know, exposure to stress hormones, et cetera. We're going to see this continue to impact families for a while, but thankfully we have some corporations step up, like DocuSign, Salmon's Financial Group, Made Good Foods have all given us donations to help us buy produce, and so many individuals that step up. So we're well positioned right now to step in and help where people need. I'm sure it's the same at Metropolitan.
And Roxanne Nava, it's not clear when this inflationary pressure might ease, when gas prices might go down, when the price of food might become more reasonable. What is the long-term impact on some of the folks that you serve of this dragging out really long?
The long-term impact is, on the positive side of long-term impact, is where COVID really, I think, had us break down silos in the community and work together as a community. So that is a positive long-term impact, is that as a community, we meet on a weekly basis for the last 2 years, so that where we provide one service and another community partner does another service for our clients. It's admirable, the resilience and grit that they face in overcoming these challenges, being a grandmother, and facing these challenges. It's going to take, while the pandemic hit overnight, it's going to take a lot longer to resolve it.
And Pete,
but we're in it for the journey.
And Pete Beal Del Vecchio, same question to you. Pandemic, inflationary pressures, higher crime. I mean, what's the long-term impact going to be on the folks that you're serving?
The long-term impact, you have to think about who is it that often needs a place like a food pantry or other help. And typically frontline workers, people who are hourly wage earners. And to get through the pandemic, and now the other shoe has dropped with all this inflation, particularly around gas prices. And so trying to earn back that savings is going to take a really long time for them to continue to, you know, try and gain some financial stability. So that's another, in addition to the mental health, that's just a very real, you know, pocketbook kind of thing that people have to deal with and figure out how to make ends meet for the long term, and
all
not
right.
just now.
A lot of concerns right now and a lot of important work that your organizations are doing. Our thanks to Pete Beal Del Vecchio and Roxanne Nava. Thank you so much.
Thank you.
Thanks, Paris.